Hi, my name is Tamia Kirksey, and my capstone project is over the affiliation between depression and exercise amongst the youth and the adults. As a young adult or as a teenager, this is a tough stage in life. You're typically struggling with starting your career or degree, you're managing your own finances, you're navigating through romantic relationships, you're making it on your own for the first time. Many college students go to college and they go off and they're excited, but then eventually this excitement turns into a struggle emotionally. You're juggling workloads, you're trying to balance your own budgets, you're handling roommates, and most of all, you're away from home, your comfort zone. Most tend to look to smoking or drinking or using drugs, and this triggers depression. As college students and adults go through their transitions in life, most of them have this frequent, intense, and uncontrollable depression that interferes with their daily routines. Depression is one of the leading causes of disability and the second leading contributor to global burden of disease. Depression is serious, common, and treatable. Today, you may see ads on the TV by the National Depression Initiative or by other organizations that aim to increase public recognition on depression. On the TV commercials, it informs you that depression does not just infect an individual's life alone, it also infects the ones they are around. It decreases a person's motivation, concentration, and tolerance. Moreover, it impacts the relationships that you have with your friends, your family, your loved ones, and your safety and productivity at work. Before I get into everything about depression, let's define depression. What is depression? Depression is a mental disorder that is common. It's presented with a loss of interest, pleasure, and your typical normal activities. You have a persistent sad moods, you're anxious, or you're feeling empty. You have a feeling of low self-worth or guilt. You have disturbed sleep and or appetite. You typically overeat or you have a loss of appetite. You have fatigue, loss of energy, and you have difficulty concentrating. You have difficulty remembering details and making decisions. Some individuals are more vulnerable to depression by genetics or hereditary factors. Some have biological, biochemical medication, and some have dietary, environmental, social, cultural factors, situations, relationships, and personal factors that relate to depression. I related physical activity and exercise to my capstone because it positively helps depression, and physical activity releases feel good endorphins and enhances your sense of well being. It takes your mind off your worries so you don't get caught up in the cycle of negative thoughts because this all feeds depression. My literature review consists of research about depression, physical activity and exercise, and treatments of depression such as antidepressants. The two main types of physical activity include aerobic and anaerobic exercises. Aerobic activity consists of brisk walking, swimming, running, cycling, dancing, even doing jumping jacks. Anaerobic activity includes plyometrics, including like box jumping and jump squats. Anaerobic activity also includes high intensity training such as HIIT training, strength training, and sprinting. A toolkit was created in Canada to help with the process of depression. Clinicians provided the patients with a few packets. This included a daily project of their moods and activity. It was like a diary. Clinicians also help these patients set up SMART goals, which are specific, measurable, attainable, relevant, and time bound. These were all centered around physical activity and exercise. A weekly schedule was then provided for their weekly sessions and workouts. The patients then either told the clinicians about their activity or they wrote it in their diary about their experience, and they had various positive statements that helped them through the program. Most of them said they wrote positive statements in their journals to keep them going through the week because of their barriers they drove through and reached their goal of treating their depression. Treatments always begin through clinical assessments to establish the type of depression, the strengths and support each patient has, and the causes of depression, and always the suicide risk to yourself or the risk to others, such as neglect. There's different other types of treatments, such as lifestyle changes, such as exercising regularly, changing your diet, your nutrition, and your sleep, which is very important. Another type of treatment for depression is psychotherapy or talk therapy. This includes CBT, which helps to restructure negative thoughts, patterns that go through a patient's head. IPT, which understands and how the patient work through failed relationships that may have caused depression. There's also problem solving therapy, and then ECT. This is used in cases where medication and or psychotherapy does not relieve a patient from any symptoms of depression. This is like a last resort. Lastly, antidepressants are primarily used to work on brain chemicals such as neurotransmitters, primarily serotonin and norepinephrine, and in some cases, dopamine, which are typically used to help treat depression. There are four classes or types of antidepressants. There are SSRIs and SNRIs, which are typically used today. Then there are TCAs. They're much older and powerful, but they're not used a lot today due to the serious side effects. And then there are MAOIs. These are the oldest class, and they're rarely used because they have strict dietary restrictions such as cheese, red wine, and anything that has tyramine in it. The most common that are prescribed to patients today include Celexa, Wellbutrin, Paxil, Prozac, and sertraline. Patients are always recommended to talk with their physicians about depression and where to get help. I am looking forward to reading more articles that link the relationship between depression, anxiety, and exercise. Today, this link is not clearly defined entirely, and the treatment regimen for exercise for depression isn't strict like you would say for a workout, for HIIT training. In conclusion, treatment of the various types of depression aims to achieve complete remission of symptoms. This comes with a trial and error period. It's vital to remember the washout periods I mentioned when you're switching from different types of antidepressants, especially when you're taking MAOIs, which is rare, but some patients do take these. It's also to remember to stay motivated and active daily. Relapse rates are high as up to 50% in the first year after recovering from depression, which is why it's important to stick to and follow a great healthy routine. Exercise helps patients gain their confidence. Meeting exercise goals, your challenges, all this boosts your self-confidence. This also helps you get more socially interacted with others. You meet and you socialize with others. You have friendly smiles or greetings when you're walking around your neighborhood or in the gym, and this lifts your mood. Great coping methods of exercise and psychotherapy are better than using alcohol or dwelling on how you feel. I believe that a healthy balance of exercise, physical activity, psychotherapy, and medications is a great treatment method in easing symptoms of depression. Okay, so that's the end of all of my new information. I am now opening this floor up to questions and answers. Here are my references. Thank you for listening to my capstone project, and I hope you enjoyed it. Have a great day.